Today we're going to talk about ADHD, otherwise known as Attention Deficit Hyperactive Disorder. This one is pretty prevalent. It's often made fun of in the media and just in culture. People are like, oh my gosh, I'm so ADD. So I thought we'd talk about it. It's a neurodevelopment disorder. Usually is caught in childhood, not always, but usually caught in childhood, and it can go all the way into adulthood. The issue is that there is a chemical difference in dopamine and norepinephrine. At least that is the current understanding of why it happens. So you may have heard the term ADD. They call it attention deficit disorder. That's an old term. The current term that is used in the DSM-5, which is the Diagnostic Statistics Manual, which is what everybody uses to diagnose people, is ADHD, or attention deficit / hyperactive disorder. Keep that in mind. The ADD is not really a thing anymore. It's not the correct term. And it was removed from the terminology in 1987. I believe it was in the DSM-3. They made the change to formally acknowledge that there is both an inattentive type of ADHD and a hyperactive type of ADHD, which we'll get into. So the people that you know who just seem to space out and kind of zone out and do their own thing, they do have ADHD, no longer ADD. It is just a different kind. So in ADHD, there's 3 presentations. The first one is inattentive. The second one is hyperactive or impulsive presentation, or combined, which is just a mix of the two. So predominantly inattentive presentation is what people used to refer to as somebody who had ADD, and it is mainly involved with issues with organization, following instructions, concentrating, attention to detail, and they may be seen daydreaming. The other more common one people talk about, and was officially called ADHD, is people you see fidgeting, excessively talking, restlessness, difficulty waiting turns, kind of impulsivity. That is classic ADHD. That is now called ADHD with a hyperactive focus. And then you have the inattentive presentation, which is the one that I talked about earlier, where people just kind of what they call space out or aren't as very organized. The biggest thing is they both have an issue with their attention. It's just how it's being showed outwardly. Some people with the hyperactivity part, they're out there doing things, kind of bounce off the walls, and it's just easier to see that. But if you have a person who's sitting there with ADHD, they are doing all those same hyperactive things, but in their own mind. And I want to point out that this person doesn't have an issue holding their attention. They have an issue channeling, because many things are taking their attention. There's kind of bouncing back and forth between all of these things that take their attention. So I thought we'd get into a little bit of how common it is, prevalence and statistics of it,